Hi, I'm Zach McDonough. I'm a student nurse concurrently enrolled here and at the College of Southern Nevada in Las Vegas, where I'm working on my ADN. Today, we're going to discuss the health of older adults living in rural settings. The concept of an older adult is easy enough, and it's just someone over the age of 65. The definition of rural, though, is a bit muddier. In typical government fashion, the Census Bureau says that rural is anything that isn't urban. There are two different subsets of urban and a bit of nuance. So, for simplicity's sake, we'll say that urban means an area that has more than 2,500 people living in it. 65 million people live in a rural setting, so that means there's quite a few discrete rural communities, and cultures can sometimes be very distinct between nearby towns. The makeup of these communities is changing as well, with the population aging for similar reasons as the rest of the country, but also because younger folks are moving to the city in search of better opportunities. These communities are also becoming more diverse. With increasing urbanization and gentrification, cost of living is decreasing in rural settings, and socioeconomically depressed populations, particularly Latinx people that are being priced out of living in their former homes, are moving to rural settings where it's more affordable. So, what health issues is this population at risk for? Well, pretty much the same issues as every other American, just at a higher rate, with the five leading causes of death being the same between people that live in a rural setting and the nation as a whole. Incidence of chronic disease is also higher, with 80% of rural older adults admitting to suffering from at least one and 50% admitting to at least two chronic illnesses. And that's compared to 64 and 24% in the same age group nationwide. There's a marked health disparity between urban and rural communities. Rural dwellers are more likely to live in poverty and be socially isolated, be less literate, and that's both general literacy and health literacy, engage in unhealthy behaviors, and have decreased access to healthy foods. Numerous hospital mergers and closures have also led to a decreased access to health care, and that's hitting a system that was already sparse with few specialty providers. So, older adults in particular are often going to be on a fixed income. They're going to be relying on government benefits like Social Security or Medicare, and Medicare doesn't cover things like dental or medications. They're going to be more prone to having decreased mobility, which can further impede their access to health care and increase social isolation in a thinly populated world that they live in. They might also have less access to or knowledge of the health resources available on the internet, and that might lead to a decrease in their ability to self care or educate themselves on minor issues. They've also been found to place less value in preventative care. It might be because of financial strain or access constraints, or maybe just an ethic of self sufficiency. But just like with anybody else, this could lead to bigger problems down the road. In terms of health promotion strategies and intervention, one's going to be to increase their health literacy. They need to be able to know where to find reputable information and judge information that they come by elsewhere. And remember to keep your education materials commensurate to their abilities, and then follow up with them so that information isn't lost to time. Part and parcel to health literacy is going to be explaining to them the importance of preventative care if you know they have a tendency not to utilize it. You should assess, though, why this is the case. Is it health beliefs, health literacy, or is it simply barriers to access that you might be able to help mitigate? When you're developing programs, it's even more important to involve community leaders than usual. Even though there may be a mile or two between houses, this population tends to put high value in maintaining a cohesive social group, so this can potentially increase receptiveness. Also, remember that the culture in the town you're in may not be the same as another that's just a little ways down the road, so assess each community independently. And when working with leaders, also be advocating for services and facilities. Sidewalks, trails, as well as a recreation and community center help maintain physical activity and decrease social isolation, but they aren't often found in rural communities. One example of a primary health prevention strategy other than health literacy is going to be vaccinations. Just because an area is thinly populated, it doesn't decrease the importance of this. You're also going to want to try to get them to decrease unhealthy behaviors like smoking and alcohol abuse, as well as give nutritional counseling when it's appropriate. Just as with the general population, secondary prevention strategies are going to include screening for risk factors that increase mortality. This, of course, is going to include hypertension, high cholesterol, diabetes, as well as carcinogen exposure like those found in pesticides that you might see in the agricultural industry. In terms of tertiary prevention, you should be advocating for and facilitating increased access to specialty care. Often, rural inhabitants are having to travel into the city to be able to find this. Some programs that might help rural dwelling older Nevadans include RSVP, which offers door to door escorted transportation, companionship, critical food and medicine delivery, as well as homemaker services. As you might expect, the Nevada Office of Food Security administers federal food security programs. On top of programs available to all ages that qualify, older adults are also eligible for the Senior Farmers Market Nutritional Program, which gives coupons for eligible healthy foods at participating farmers markets. and the Commodity Supplemental Food Program, sometimes called the Senior Box Program, which directly provides healthy foods with nutrition sometimes not seen in a low income diet. With the COVID pandemic and its disruption of vital services, the UNR Co op Extension organized volunteer organizations to begin food and medicine delivery and provide social interaction with rural older adults. They also been providing nutrition and physical activity classes virtually. The pandemic has also made social isolation that much worse for rural seniors, and the NEST Collaborative provides one on one phone calls twice a week, as well as facilitating weekly peer social group conference calls so that older adults can still remain social. So, are these programs effective? Yes, but not as much as they could be. To take from the Office of Food Security's report on their senior programs, the average score out of 5 as to whether a participant thought their needs were being met was just 3.06, and the office listed 19 areas where improvement was needed, including lack of transportation options for rural seniors and the amount of red tape that's sometimes needed to enroll in some of the programs. So, some key takeaways. The rural population is changing. It's getting older and it's becoming increasingly diverse and often for reasons that are different from the general populace. This population, especially those that are considered older adults, are an often forgotten socioeconomically disadvantaged group and suffer from a large healthcare disparity. They tend not to be a cause celeb and must rely on governmental programs that can be cumbersome at best. Older rural dwelling Americans also have higher mortality rates than the general populace, and an increased incidence of chronic disease and unhealthy habits, including smoking, substance abuse, and poor diets. Access to healthy food and healthcare, both physically and financially, is an obstacle that needs to be overcome to correct this. And finally, the pandemic has brought further isolation to an already isolated yet tight knit population. Don't forget to assess for mental health issues, since while they're not any less likely to seek help, they have a tendency to misidentify mild and moderate mental illness as just another thing that comes with aging.